Hintayin na natin iba. Okay. How many are you na? 8. Sana join na agad yung iba so we can finish this topic. Message lang ako sa group chat na mag-join na sila. How many natin? Naku, babalik pa ba kaya yung iba? Okay, habol na lang sila. Okay, so as I was saying, there are clinical signs of inflammation, no, yung redness. Bakit namumula? Because of the rush of the blood towards the area to bring the blood cells, yung mga white blood cells or soldiers natin to kill the pathogen. There's heat, mainit yung inflamed area because of the rush of the blood, okay? There's inflammation because of the dilation of the blood vessels to wall of the pathogen, or dilation of the capillaries, specifically the capillaries. Okay, it's a type of blood vessel to wall of the pathogen. And then there's loss of function. Of course, that tissue will not be function while it still is being injured. Okay, so those are the signs of inflammation. So that would explain why there's redness. Okay, there's inflammation, namamaga siya. Okay, so there's red edematous. Edematous meaning that's the inflammation. And then exudative tonsils because there's pus in it. Okay, mga nana. Okay, then another clinical sign of scarlet fever is desquamation at the palmar surface of the skin. So magbabalat yan, magbabalat. It's an effect of the toxin released by the pathogen. Okay, mode of transmission. So that we would know how to prevent infection, we have to be very cautious with this transmission. Human to human, okay? Human to human, direct contact. Usually yung mga hands from one person, tapos sa limba, nag-shake hands kayo, bumahing siya, umubo siya. So there's pathogen in his hands. Tapos nakipag-shake hands sa'yo. So from your hand to your mouth, okay? Or through the aerosol droplets, because remember the pathogens are in the tonsils and in the pharynx. So every time there's droplets, okay, they are excreting the pathogen, and so you can catch them. Okay, secretions from patients, nasal carriers, contaminated dust. So meaning they are just everywhere in our environment. So from that contaminated dust, so we can inhale them. Okay, through contaminated handkerchief, and that is why there should be no sharing of hanky, and then contaminated milk also. Okay, ingestion of contaminated milk and other milk products. So these are the modes of transmission. So of course, knowing the modes of transmission will help us prevent infection. Okay, so diagnosis. So we do swabbing of the throat, and then from that throat swab, we culture them. Ano nga ulit sabihin ng culture? Yung pinapatubo natin sila dun sa culture media. And another is bacitracin test, bacitracin susceptibility. Okay, this is what I have explained a while ago. Okay, yung bacitracin test. Okay, treatment. Okay, penicillin is the drug of choice. However, for some patients that are resistant to penicillin, they are given cephalosporin as an alternative. Okay, sometimes for those that have an adverse effect to cephalosporin and penicillin, they are given erythromycin. So all of these three are effective, but sometimes it is patient-based that if you have allergy to this, then you are given the alternative antimicrobial agent. Okay? Okay. Another disease. Another disease of our respiratory system is pneumonia, and this is very common. So it is usually manifested or accompanied with fever because there's invasion of the lungs, productive cough, acute chest pain, chills, and shortness of breathing or difficulty of breathing because of the inflammation of the lungs. So many different bacteria can be the culprit like Haemophilus influenzae, Pseudomonas aeruginosa. Ayan si Pseudomonas aeruginosa. Now you know that it can cause skin infection, it can cause conjunctivitis, then it can also cause pneumonia. Okay? Klebsiella pneumoniae, Serratia marcescens, Streptococcus pneumoniae. So these are the many causes of pneumonia. And usually, they are nosocomial. Pag sinabing nosocomial, the person can acquire them, okay, from the hospital. Okay, patients are lying down, so the cilia cannot function to propel away or to sweep away the pathogen. So then it can go directly. So mabri-breach niya yung first line of defense. So makakapasok siya ngayon sa loob ng katawan. Okay? So who are these persons that can acquire them from the hospital? It could be patients, okay? It could be patients, mga inpatients, outpatients, or even laboratory personnel or any hospital staff whose immune system is very weak, so pwede nilang makuha yung sakit doon sa hospital. That's the meaning of nosocomial infections. But of course, mas makakakuha nun yung mga sick patients because when you are sick, your immune system is weaker. Okay. So this is Streptococcus pneumoniae. So lahat ng Streptococcus, they demonstrate this, yung in chain. Okay, they demonstrate a chain characteristic. They are round, so we call them the cocci. And they are gram-positive, so they are always blue or violet. Now, if you look into this picture, okay, so these are the white blood cells. And these are the pathogen. Ito yung mga pathogen. Okay, these are the Streptococcus. Now, Streptococcus pneumoniae is second to Streptococcus pyogenes, being a very pathogenic member of the species Streptococcus. And it causes pneumococcal type of pneumonia. Just to differentiate it from the pneumonia caused by other bacteria. Kaya tinawag na pneumococcal pneumonia. So, are you familiar with the pneumovax, yung pneumococcal vaccine? Have you heard of the pneumococcal vaccine? So the component of that is Streptococcus pneumoniae. Now this organism causes nagre-release ng enzyme, secretes an enzyme which causes damage to the lungs. So as a reaction of the lungs, it gets inflamed, okay? So there's accumulation of fluid and that is why there is difficulty of breathing. Ang tawag natin dun sa accumulation of fluid is edema or the fluid is edema. And so the lung tissue is edematous and that is why it is inflamed, okay? And there is risk of meningitis if bacteria get into the circulatory system. So this is one of the complications of pneumonia. So if you look or if you make this survey, no, so yung mga patients na nagkakaroon ng pneumonia, so in most cases, they suffer from meningitis. So the reason is because this organism gets into the bloodstream, then from the bloodstream, the organism gets to the meninges of the brain, causing meningitis. So it's the secondary complication. Okay? Okay. So can it be treated? Yes, antibiotics. Okay? So any broad spectrum antibiotic. And it can actually be prevented through a purified capsular polysaccharide. So this is the component of the vaccine. So nauso yung mga pneumococcal vaccine that is against 13 strains. I'm sure you have heard of it. Yung merong mga vaccines against 5 strains, merong mga vaccine against 8 strain, at merong mga vaccine against 13 strains. Yun yung pinakamahal. Okay? Yung it could target 13 or more strains. That's the most expensive new vaccine to prevent pneumonia. But it's available here in the Philippines. Okay? So another type of pneumonia is called walking pneumonia. It is caused by the organism Mycoplasma pneumoniae. Bakit tinawag na walking pneumonia? It's just a connotation because the organism can be spread through aerosol. So when there are aerosol droplets, okay, so they can be scattered all throughout in our environment. So it walks along with us, people, kaya tinawag na parang walking pneumonia. So you can acquire these droplets, gets into the lungs, okay, and may cause pneumonia. But the good thing is, the good thing is that as an advantage to any other organism causing pneumonia, this Mycoplasma pneumoniae is usually self-resolving. Anong ibig sabihin nun? Self-resolving, self-limiting, meaning they heal on its own. Okay? It can heal on its own. So, syempre, pagka meron kang pambili ng gamot, mag-antibiotic ka, so the more that it will work. Pero let us say it was left undiagnosed, tapos hindi ka nag-antibiotic, mariresolve siya on its own. So, ang tawag natin doon ay self-limiting disease. Okay? Madami namang sakit na ganun, self-limiting, meaning they can heal on their own. Especially if your immune system is working. Okay, so what is the reservoir of this Mycoplasma pneumoniae? Infected humans. Hindi tulad ni Streptococcus pneumoniae na nandyan lang sila sa paligid, so humans at saka environment. But for Mycoplasma pneumoniae, you can acquire them from infected humans, so human-to-human infection. So that's direct contact. So mode of transmission via droplet inhalation from infected individuals, direct contact with an infected person, or the use of any object or articles contaminated with nasal secretions or sputum from an ill or coughing patient. So meaning talagang human to human lang siya. So hindi mo, I mean, for example, ako, positive ako. So when I sneeze, when I cough, so I expel them all throughout in the environment. And then if you can catch them, so that's how you acquire the infection. Okay? Okay, diagnosis. Detection of antibody in the blood, so blood tests, okay, to determine if there is antibody present against the pathogen. And then also we cannot get away with culture. So that's the reason why I discussed to you the culture media before, because in the laboratory diagnosis for bacterial infections, one of the best method done in the lab is culture. Okay, so culture, we cannot get away with culture. So each of these different bacteria have their own characteristic appearance in the culture media. So in the case of this pathogen, it demonstrates a tiny fried egg colony. So isipin mo lang, ano itsura ng fried egg? So that's how they look like in the culture medium. Okay, another disease of the lungs or of the respiratory system is called Legionnaire's disease, and the pathogen is Legionella pneumophila. Okay, this is spread, so this is the mode of transmission, can be spread by fine water droplets in the air. Okay, so anong water droplets ito? Coming from water from fountains, spa, humidifiers, air conditioners. So once they are in the atmosphere, you can inhale them and then may lodge in our lungs. And from there, since we have a lot of macrophages and other white blood cells, so they may be phagocytized, but even if they are already phagocytized, they can still survive, okay, within our phagocytes. Why? Because as I have mentioned before, our phagocytes can only engulf. Okay? Now, for this bacteria to be killed, dapat efficient talaga yung ating immune system that when they are presented, when these pathogens are presented by our macrophages to the white blood cells, then the white blood cells will be the one to perform either cellular immunity, meaning direct killing, or humoral immunity, meaning yung mga B lymphocytes, magiging plasma cells. Si plasma cells magproproduce ng antibody, and the antibody will be the one to destroy the pathogen. So that's how it is inside the human body. Okay. Now this organism produces the enzyme beta-lactamase. So ano-ano ba yung mga antibiotic na meron silang beta-lactam? Penicillin, ampicillin. So pag binigyan mo ng penicillin or ampicillin, the organism will be resistant to that. Kasi si organism magproproduce ngayon ng beta-lactamase enzyme, and this beta-lactamase enzyme will destroy the beta-lactam ring of the antibiotic. So masisira yung antibiotic. Hindi tatablan ng antibiotic yung pathogen. Okay? Now this organism from the lungs can go to our circulatory system. So magiging systemic infection or blood infection. So if the organism is not treated with antibiotics containing lactam like penicillin, ampicillin. So ibibigay is erythromycin and rifampicin because they don't have this lactam ring. Okay? Okay. So this is the organism. It is a bacilli. So they are bacilli. So these are the other terms for the legionellosis or Legionnaire's disease, Pontiac fever, because it can cause fever. Lahat naman ng may invasion, talagang we cannot get away with fever as a sign that our immune system is fighting. So these are the signs and symptoms: anorexia, myalgia, headache, high fever, there's chills, dry cough followed by productive cough. Okay, difficulty of breathing, lagi kasama yan, shortness of breath. Kasi nga, invaded yung lungs so mamamaga yung lung tissue. Okay, diarrhea, okay, pleural and abdominal pain because of the invasion of the lungs by the pathogen. Okay, these are the reservoir. So they are found in our environmental water sources like the ponds, the lakes, the creeks, hot water and air conditioning systems, hot tubs, shower heads. Makakasurvive sila dyan. Nandyan lang sila. Okay, and then mode of transmission, airborne transmission. So from the air, we can inhale them. Okay, so diagnosis, we can culture the urine, we can culture the sputum, we can culture the blood. So ang tawag natin doon ay C and S. C stands for culture and S stands for sensitivity test. So ang ginagawa sa lab, i-culture, patutubuin yung bacteria, and then antibiotic testing. Yun ang tinatawag na sensitivity testing. Antibiotic testing to determine what is the most appropriate antibiotic to be prescribed to the patient to treat the infection. And the recommended culture medium, of course, is a selective culture medium, which is the buffered charcoal yeast extract agar. To ensure na pag may tumubong pathogen, siya talaga yon. Okay, no any other organism. Okay, then diphtheria. So the pathogen is named diphtheriae, Corynebacterium diphtheriae, hence the disease is called diphtheria. It is an aerobic bacteria. It is gram-positive. So diphtheria is characterized as an acute contagious, nakakahawa. Okay, contagious bacterial disease primarily involving the tonsils, the pharynx, the larynx, and the nose. So meron kang tonsillitis, may pharyngitis ka, may laryngitis ka, may sinusitis ka. In short, masakit talaga yung lalamunan mo. Okay? And the organism is capable of producing a toxin called cytotoxin. So cyto means cell. So this toxin targets body cells. Okay, causing damage to our body cells, and it targets also the cells of the oral cavity. Kaya pag tinignan mo yung tongue, adherent grayish white membrane in the trough. Okay, to compare it or to differentiate it from Streptococcus pyogenes na reddish strawberry or pinkish strawberry, dito grayish white. Pag grayish white, diphtheria yan. Okay? Okay. Ito. Okay, grayish white. So you can see white patches also of the tongue as an indication of yung mga pseudomembranous formation at saka yung pus cells. Okay? And then this is skin diphtheria. So meron tayong tinatawag na skin diphtheria. For example, meron kang sugat. So there's wound on the skin or there's cut in the skin, and then the organism or the pathogen contaminates the tissue. Okay, gets inside the tissue. And so that is an infection. Okay. Okay. How do we prevent diphtheria? So I'm sure when you were babies, you were given this vaccine called DPT, which is against 3 organisms or 3 diseases. D for diphtheria, P for pertussis. Okay, pertussis is whooping cough disease. And then T for tetanus. So one shot lang yon, but that one shot or that one vaccine is again, it contains 3 different attenuated bacteria of the diphtheria, pertussis, and tetanus. The diphtheria caused by Corynebacterium diphtheriae. Si pertussis is caused by Bordetella pertussis bacteria. We will discuss that later on. And then si tetanus is caused by Clostridium tetani. Okay, so 3 against 3 bacteria. And then, so that's how to prevent. Okay, so let us say your immune system did not work. Okay, you did not produce antibody to fight them. And now you suffer from an infection. So what is the diagnosis? So laboratory diagnosis is Schick's test. So how is this done? 0.1 ml of diluted diphtheria toxin is injected intradermally into the arm of the person. And then if a person does not have enough antibodies to fight it off, the skin around the injection will become red and swollen. So that is the reaction, indicating a positive result. Okay, so this swelling disappears after a few days. If the person has an immunity, then little or no swelling and redness will occur, indicating a negative result. Okay, so that's the laboratory test. So ganyan siya ginagawa. Okay, then another laboratory test or laboratory diagnosis, nasopharyngeal swab. Okay, kasi nga, di ba, they can also reside in the nose, leading to sinusitis, so nasopharyngeal swab. And since they can also reside in the larynx, in the pharynx, then we can do throat swab. And then the swab, the cotton swab can be cultured in the culture media. The culture media is especially cooked for isolation of the diphtheria bacilli, and it is called Loeffler's serum and cysteine telluride. Or another culture media selective for it is Tinsdale medium. Okay. Treatment erythromycin for those who are not treated with, for those that are resistant against erythromycin, patients are given penicillin. Okay. So these are the different antibiotics to treat diphtheria. Okay, pertussis. So what is the P in the DPT? Diphtheria pertussis. Pertussis is, the common name is whooping cough disease. The organism is also a bacilli. This is caused by the organism, by the bacilli Bordetella pertussis. Hence, the infection is called pertussis. So this can be spread through the aerosol. So yung bumabahing, umuubo, so spreading, expelling the organism, and without mass, you can contract the infection through these droplets. And once it is inside the human body, the organism can produce a toxin called pertussogen, okay? Pertussogen, which damages our cells. So it colonizes the lungs, okay, produces enzyme that damages the lung tissue, and once there is degradation of the lung tissue, magkakaroon ng build-up ng mga cell debris galing dun sa damaged tissue. And then yun yung babara. Okay, so they will plug up the bronchi and the trachea, and that is the reason why there's difficulty of breathing. So yung talagang hirap na hirap ka ng huminga, and then it will produce, and then you will develop cough. Okay, whooping sound as patient struggles to breathe. Kaya tinawag na whooping cough disease. And then treatment, broad spectrum antibiotics. So this is the idealized picture of the organism. So they are bacilli, okay, yan. And they are flagellated, okay. Okay, so how do we describe pertussis? It is a highly contagious infection or disease, and there are stages of which the first stage is prodromal or catarrhal stage. During this stage, person is having this cold-like symptoms. So, simpleng ubo lang, kaya akala niya hindi pa ganun ka-serious. Now, if there's no treatment, it will progress into the secondary stage. We call that stage paroxysmal. Here, the cold-like symptoms become severe. So patuloy-tuloy yung pag-ubo. Okay, uncontrollable coughing. So, coughing may be so severe to cause lung rupture, bleeding in the eyes and brain, broken ribs, rectal prolapse, or hernia. Now, if it is treated, okay, if it's treated, then luckily patient will enter the stage of recovery or convalescence. Okay, pero matagal. It takes about weeks. Okay, it takes weeks for the patient uh, to enter the stage of recovery. Okay, so what I would like to show here is a picture of baby with uncontrollable breathing. Here also a child with uncontrollable breathing. I mean, not breathing, coughing. Okay, yung ubo-ubo. So at this stage, they are already in the secondary stage, paroxysmal stage of the pertussis. Okay? Okay, reservoir and mode of transmission. So infected humans are the reservoir. So if the infected person or the person positive with pertussis is coughing in front of you and you are not wearing a mask and so is the person, then you are catching up the droplets. And from there, okay, the organism is definitely the droplet. So from there, they could enter the human body, reside in the throat, and then goes to the lungs. Okay. Diagnosis, nasopharyngeal swab or nasopharyngeal aspirate. And then the swab can be cultured into a special culture media called the bordet. Bordet, from the name of the organism, Bordetella. Okay, Bordet genjau agar or the Regan low agar. So these are special or selective culture media for Bordetella pertussis. Okay. Then of course you're familiar with pulmonary tuberculosis. Okay, this is pulmonary infection which can become systemic. So meaning from the lungs, the organism goes to the bloodstream. So systemic infection na yon. And the causative agent are the following. The most common is Mycobacterium tuberculosis. Occasionally, it can be caused by Mycobacterium africanum, or if it comes from cattle, because the source was from cattle, na infect ka ng isang, na-contaminate ka ng infected cattle, okay, because in the cattle, they have this Mycobacterium bovis, which may start as inflammation of, dito, lahat ng cervical lymph nodes mo mamamaga, okay, and then eventually, it goes to the lungs, okay. So has unusual cell wall that protects it from degradation once ingested by phagocytes. So even if they are already inside the phagocytes, okay, they can still undergo binary fission. So pumasok, na-inhale mo, pumasok, okay, but in the lungs, so you have a lot of these macrophages, then they will be engulfed by the macrophages, and then they still continue to divide. So once they divide, they keep on dividing, they multiply in number. So what do you think will happen to the macrophage? Phagocytizing or engulfing them. It will rupture. Puputok ngayon yung macrophage kasi ang dami na nila eh. Natatalo na yung macrophage kasi nagpatuloy sa cell division yung organism. And so that is the time that so the organism are now released, okay, into the lung tissue kasi pumutok na, nag-rupture na yung macrophage. So they are released into the lung tissue and that is what we call now invasion. So they invade the lung tissue and then leading to yung caseous cheesy secretion, okay? So because of the injury to the lungs, and so when the patient's expectorate flame, galing yun dun sa injured lung, yung phlegma. So that contains mga dead neutrophils. Of course, they are pus cells, okay? And 90% of those infected are almost always asymptomatic carrier. So ibig sabihin, hindi mo alam, you are harboring the pulmonary tuberculosis bacterium or Mycobacterium tuberculosis. And that is why it spreads easily. And that is the reason why in the up to the 80s, okay? So tuberculosis is a worldwide disease. It is very endemic in Asia, particularly in the Philippines, and even worldwide, even in the US. Okay, and dami-dami, especially up to the early 1980s. Hence, it was described as, I've read one book, no, dinescribe siya as the captain of all men of death, okay, during the early 80s. Bakit? Kasi nga, it is the leading cause of death before. It is the leading cause of death before. So bakit siya, bakit nakakamatay kung meron namang antibiotic? Kasi matagal naman nang na-introduce yung antibiotic. And in fact, Mycobacterium tuberculosis can actually be killed by the antibiotic. Okay, rifampicin, isoniazid, ethambutol, okay, ethambutol, rifampicin, pyrazinamide. So yung apat na yon, they are very, very effective against Mycobacterium tuberculosis. So kaya tinawag siyang quadruple drug therapy. Apat yon, quadruple drug therapy. So ethambutol, isoniazid, rifampicin, pyrazinamide. Okay? So, going back. So, bakit siya nakakamatay? Eh, ang dami ng mga antibiotic and the antibiotics are effective. Okay. Ganito kasi. One reason, it can readily spread. So, a lot of people are suffering from it unknowingly. Now, those who have lower immune immune resistance, really get sick from the condition. So there are antibiotics, but if the antibiotics are not taken religiously for 6 consecutive months, of course, hindi sila gagaling. Ang pag-inom ng antibiotic is 6 consecutive months. Tuloy-tuloy yan. Tuloy-tuloy lang. From day 1, okay, up to, so 6 times 3, up to 180 days. Okay, you will only be taking one what do you call this? One drug, but that one drug is quadruple, meaning it contains 4 drugs. Isang tableta siya. It's a very big tablet containing the 4 medicines. It's a combination of the 4 medicines. So that is why we call it quadruple drug therapy. So when the doctor says, okay, you have to take this for 6 months, then strictly you have to take that for 6 months, from day 1 up to 180th day. Now, let us say, after 2 months of taking the medicine, okay, after 2 months of taking the medicine, and then you stop. Let us say you were not able to buy because you ran out of financial resources or whatever reason. So, ilang araw ka nang hindi umiinom. Let us say 5 days, 1 week ka nang hindi umiinom. And then, pag may money ka na, okay, i-continue mo na lang yung remaining. No, you go back to day 1. Babalik ka sa day 1. So, that's the reason kung bakit ang daming namamatay dati. May antibiotic, but the antibiotics are not religiously taken by individuals. So, anong ginawa ng DOH? What the DOH did was, okay, they have this program of wanting to eradicate tuberculosis in the Philippines. So they subsidize. So they had this budget for medications, which was distributed to different barangay health centers or local health centers, and the constituents of the barangay can go to the local health centers, ask them the medicine, and then ibibigay naman. And then you go home with the medicine with you. Kasi meron kang evidence na may tuberculosis ka talaga. Merong prescription ng doctor, meron kang diagnosis, papakita mo yung diagnosis mo, bibigyan ka ng mga health centers. Were you being monitored if you are really taking the medicine straight for 6 months? And in most cases, no. Okay, so hindi ka talaga gagaling. So, binago ngayon ng DOH. I'm sure you are familiar with this. We have what we call DOTS. Have you seen that all over? Okay, it's widely distributed all over the Philippines. May makikita kang signage, DOTS, D-O-T-S. Okay, it's an acronym, malaking D and then O-T-S. Tapos there's an arrow, okay, the dots here, okay, pointing to a particular street going to where the DOTS clinic is. Nakikita nyo yon? Napapansin nyo? Bago mag-pandemic, nung kayo ay lumalabas pa, napapansin nyo sa barangay ninyo or sa mga pinupuntahan yung lugar? May nakita na kayong ganong signage? Meron?
Meron po, ma'am.
Okay. Yun ang program ng DOH. So kung dati ang ginagawa ng DOH, nag-distribute ng mga gamot sa different health centers, si patient, binibigyan ng gamot, uwi na si patient, hindi na mo monitor. So sa DOTS, DOTS means D for directly observed treatment short course, directly observed treatment. So if you are from that particular barangay, meron kayong DOTS talaga sa area ninyo. So you go to your barangay, okay, bibigyan ka ng gamot, iinumin mo yung gamot doon sa clinic na nakikita that you are really taking the drug, okay, na iniinom mo talaga. Okay, and that is for a daily basis. Dapat ideally dapat. So I don't know. Ningas ko naman tayo karamihan. Baka sa umpisa lang. And then later on, masyado ka nang nagtiwala sa patient, bigay mo na lang yung gamot, hindi mo na namomonitor yung gamot. Pero ideally, okay, that should be the case. Na everyday pupunta yung patient doon sa barangay health center or sa health center ng barangay na nakakasakop sa kanya, and then he or she is given the medication. So na-observe ng naka-duty na nurse or doctor na talagang iniinom niya. So directly observed treatment, short course. Short course meaning in a short span of time, 6 months, magaling ka na. You are already free from the disease. Okay, now, you cannot reason out na, naku, araw-araw wala akong pamasahe papunta sa DOTS. Kaya nga ang ginawa ng DOH, ang ginawa ng mga LGUs, bawat barangay meron para hindi ka nalalayo. Bawat naka-strategically spread sila in such a way that you have readily access to that barangay, to that health center. So hindi mo pwedeng i-reason out na wala naman akong pera, pamasahe, papunta dun sa health center para makahingi ng gamot. No. They are strategically positioned so that every sick person can have access to the barangay health center. Libre yun. So that is the program of the DOH because they wanted to eliminate TB in the Philippines. Kasi nakaya nila eh. Na-eradicate na. Wala ng polio. Wala ng diphtheria. So this is one of their targets, tuberculosis. Okay, so once you are able to catch the droplets and your immune system is weak, so hindi siya malalabanan ng ating mga soldiers. And so in our lungs, okay, once the macrophage ruptures, so they set in the lung tissue and it begins as a lesion. It begins as a lesion, exudative lesion. Exudative kasi may nana. Okay, may mga exudates, may nana. And that lesion is made up of bacteria. So the phagocytes and the fluid are also present in that lesion, okay, which appears like pneumonia. Okay, so yung mga lesions na yan din yung nakikita doon sa x-ray. Now, bacteria will hide from immune system by living inside the phagocytes. And the phagocytes will form long strings of cells called tubercules. So na-picture nyo, pumasok, okay, and then pumasok through the nose, gets into the lungs, and then they are phagocytized by our phagocytes. Inside the phagocytes, dun na sila nagtago. Okay? And they continue to multiply inside the phagocytes. And then the phagocytes will form long strings of cells called tubercules. Now, over several months, the tubercules can form granuloma. So, ito yung nakikita sa x-ray na bukol. Okay, pag nagpa-x-ray, may nakikitang nodule. That's granuloma. So that is a mass of tissue filled with, okay, yung mga cells. Anong cells to? Yung mga white blood cells mo na ikinukulong nila yung pathogen. Ikinukulong nila yung Mycobacterium tuberculosis. Kaya tinawag na granu. It is in reference to granulocytes, our white blood cells. Oma means a tissue. Okay, yung ating mga white blood cells, the neutrophils. So, yun yung nakikitang bukol. Kaya pag may nakitang bukol sa x-ray, okay, so ang impression, pag tinignan mo sa baba ng diagnosis, impression or remarks, granuloma, meaning you have an inactive case of tuberculosis. Huwag mo sabihin na, okay lang, wala akong TB. TB na yon, that's already tuberculosis, but it is inactive. Bakit inactive? Because your immune system is working, your immune system is fighting, tinutulungan ka nila, nilalabanan nila by enveloping, ikinulong nila yung pathogen. Yun yung nakikita, kaya inactive tuberculosis. Now question, is there possibility of developing from the inactive, magiging active case of tuberculosis? Yes, if your immune system is weak. Pag mahina immune system mo, matatalo yung neutrophils mo. And then, magliliquify. Okay, natalo eh. Magliliquify, then the organism inside will be released. Okay, magbe-break. Liquefy meaning it will break into pieces. It will break off. And then, releasing the organisms, okay, invading the lung tissue, or some of them can invade the bloodstream. So that's systemic infection. Okay, so they can be coughed up pag umubo ka. So from the lungs, aakyat papunta dito sa pharynx, sa larynx. Pag umubo ka or nag-swallow ka, bababa, okay? And then from there, it can go to the blood circulation. So systemic infection na yun. Ito yung mga cases ng talagang severe cases of tuberculosis. Okay? But don't worry, it can be treated. Sabi ko nga, 6 months. Okay, daily basis of taking the quadruple drug therapy. Okay, now, so what are the forms of TB? One is latent, okay? So